Welcome to SDS Restaurant Group. This video presentation is intended to inform you about all of the benefits offered to you and help you make decisions about the benefits you would like to enroll in for yourself and your family. The elections you make during this enrollment period will be in effect through September 30th. Each year prior to October 1st, you will have the opportunity to make changes to your plans during open enrollment. We are proud to provide employees with a comprehensive benefits package. Our health insurance plans are with Florida Blue. If you use tobacco products, $10 will be added to your bi-weekly health insurance cost. The dental insurance is with Florida Combined Life. The vision and life insurance plans are with Sun Life. Our disability insurance plans are with Reliance Standard. We also offer accident plan and a critical illness plan through Sun Life. You will enroll in your benefits online through our Ben Express enrollment system. Over the next few minutes, we will describe each benefit in greater detail. Please note, once you enroll in benefits, you are not able to change your elections or drop coverage until next open enrollment, unless you have a qualifying event such as marriage, divorce, birth, or adoption of a child. Please take time to review all of your options before making your elections. The details of our benefits package and the cost per pay period are described in our benefits guide. Contact information is included in the guide for our insurance carriers and benefit consultants at Highland. Be sure to keep this guide handy throughout the year. All full-time administrators, area coaches, restaurant general managers, and assistant general managers receive term life insurance and accidental death and dismemberment insurance. Your benefit amount is based on your monthly earnings. SDS Restaurant Group pays the entire cost for this coverage. The base life plan includes valuable online will preparation assistance. Be sure to review and update your beneficiary information when enrolling in Ben Express. All employees eligible for base life insurance are offered access to Sun Life's Employee Assistance Program through ComPsych. This program gives you access to confidential counseling and referral services 24 hours a day, 7 days a week. You can get assistance with many life-related topics such as relationship conflicts, stress and anxiety, financial questions, work and family life concerns, and even legal support from attorneys. Contact information for ComPsych is provided in your enrollment guide. All benefit-eligible employees have the opportunity to purchase voluntary life insurance through Sun Life. You can purchase coverage for yourself in $10,000 increments up to $500,000. On your spouse, you may purchase $10,000 increments up to $250,000, and you may purchase $2,500 increments up to $10,000 of coverage for your dependent children. This coverage includes double indemnity for accidental death and dismemberment. During this enrollment, you have a valuable guarantee issue opportunity to purchase voluntary life insurance coverage up to the guarantee issue amounts shown here and in your benefits guide with no medical questions asked. Any election over the guarantee issue amounts will be subject to evidence of insurability and approval by Sun Life. The cost for this coverage is calculated for you when you choose a benefit amount in Ben Express. The voluntary life insurance plan with Sun Life includes valuable online will preparation assistance. Please see your benefits guide for more details. We offer you the opportunity to purchase short-term and long-term disability insurance through Reliance Standard to protect your income in the event you cannot work for a period of time due to an illness or injury. The short-term disability insurance provides 60% of your pay up to $1,500 per week, and benefit payment begins on the 15th day of disability. The benefit may continue to be paid for up to 90 days. Our long-term disability insurance will provide 60% of your pay up to $7,500 per month. Benefit begins on the 91st day of disability, and long-term disability benefits are payable for 24 months if unable to perform the duties of your job, or to Social Security retirement age if unable to perform the duties of any job. You can enroll for these coverages during this enrollment as a new hire with no medical questions asked. You are guaranteed the coverage. If you decline this coverage during your initial enrollment and wish to enroll at a later open enrollment, you will have to complete the evidence of insurability form and be approved by Reliance Standard. There is a pre-existing condition limitation on these coverages. Any condition you are treated for in the 3 months prior to your coverage effective date will not be covered until you've been insured under the plan for 12 months. Our dental plan with Florida Combined Life covers services from network and non-network dentists. network dentists have agreed to accept reduced fees. Charges from out-of-network providers will be higher, and they may bill you for the amounts in excess of the amount paid by insurance. For this reason, we encourage you to use network providers to save on your out-of-pocket costs. When using a network dentist, the plan covers preventive services such as cleanings and x-rays at 100%, basic services such as fillings at 80%, and major services such as crowns at 50%. For services other than preventive, you pay a $50 deductible per person, up to a $150 family maximum. The maximum that Florida Combined Life pays per covered person is $1,000 per calendar year. The deductible and benefit maximum will start over on January 1st. Orthodontia coverage for children up to age 19 is covered at 50% to a maximum lifetime benefit of $1,000 per covered child. Our dental plan includes a rollover benefit, which gives you the opportunity to accumulate additional coverage on your annual benefit maximum for the following year. If you receive at least one covered service during the plan year and your claims don't exceed $500, Florida Combined Life will add $350 to your annual benefit maximum for the following year. You can do this until you have accumulated an additional $1,000. This benefit is available to you and any enrolled dependents on the dental plan. Our vision plan with Sun Life offers exceptional benefits at an affordable cost. If you use a network vision provider, you pay a $10 copay for a routine eye exam once every 12 months. Most lenses are also available for a $25 copay once every 12 months. You receive a $130 allowance towards the cost of your frames, plus 20% off the balance over $130. If you choose contact lenses in lieu of glasses, the plan will cover the cost up to $130. The vision premiums are shown in your benefits guide. We offer 3 medical plans with Florida Blue, and we use the Blue Options national network of providers. You can save money on your healthcare services by doing things such as using your primary care doctor or urgent care center for non-emergent illnesses or injuries versus going to the ER. When you need a prescription filled, ask for a generic medication and save on your copay costs. Using a standalone facility for lab work, outpatient surgery, or a diagnostic scan such as X-ray or MRI can save you almost half the cost of having these services done in a hospital. When deciding which medical plan will best fit your needs, consider things such as payroll deduction cost, the deductible and out-of-pocket amounts, how often you use the medical services, and the prescription coverage that you need. Our plans cover in-network preventive care at 100%. No deductible or copay applies. This includes coverage for annual physical exams, well woman, well man, and well child exams, lab work associated with an annual exam, flu shots, mammograms, and prostate exams, just to name a few. We encourage all employees to take advantage of this benefit and seek routine annual checkups at no cost to you. Early detection can lead to better outcomes. If you enroll in the base plan, you will pay copays for physician office visits and prescription drugs. The deductible does not apply. Our base plan has a $7,000 per person deductible with a $14,000 family maximum. The deductible applies to services such as urgent care and emergency room visits, X-ray and complex diagnostic imaging, outpatient surgery, and inpatient hospital stays. Lab work is covered in full at independent lab locations such as Quest. After you meet the deductible, Florida Blue will pay 70% of covered medical services, and you will pay 30% until your combined copays and 30% coinsurance reach the out-of-pocket maximum. Then you will have 100% coverage until the end of the plan year. Please note that our base plan only offers a copay for generic prescriptions. Select brand name drugs in Tier 2 are covered subject to the deductible, then 20% coinsurance. Preferred brand name drugs in Tier 3 are not covered. You can download the OneRx mobile app, which will allow you to search for lowest cost prescriptions and redeem prescription coupons. If you enroll in the mid plan, you will pay copays for physician office visits, X-ray and complex imaging, urgent care and emergency room visits, and prescription drugs. This plan will have a $2,500 per person deductible with a $7,500 family maximum. The deductible applies to outpatient surgery and inpatient hospital stays. A per occurrence copay of $300 applies to each inpatient hospital stay, in addition to the deductible and coinsurance. Lab work is covered in full at independent lab locations. After you meet the deductible, Florida Blue will pay 80% of covered medical services, and you will pay 20% until your combined copays and coinsurance reach the out-of-pocket maximum. Then you will have 100% coverage until the end of the plan year. The High Plan has a $1,500 per person deductible with a $4,500 family maximum. The deductible applies to outpatient surgery and inpatient hospital stays. Lab work is covered in full at independent lab locations. You will pay copays for physician office visits, X-ray, complex imaging, urgent care and emergency room visits, and prescription drugs. After you meet the deductible, Florida Blue will pay 80% of covered medical services, and you will pay 20% until your combined copays and coinsurance reach the out-of-pocket maximum. Then you will have 100% coverage until the end of the plan year. Prescription drug costs continue to rise, and it is important to be a careful consumer and shop around for the lowest cost for your prescription by using the Highland Script Navigator tool or utilizing the Florida Blue member portal to help you compare drug prices at your local pharmacies. If your doctor prescribes an expensive brand name medication, ask him or her if there is a generic equivalent that you can take. You can also save money by asking your doctor for a 3-month prescription of your maintenance medications and order them through the mail order program with Florida Blue. A 3-month supply of your medication will be delivered right to your door, and you will only pay 2.5 copays instead of 3. See your benefits guide for more details. Florida Blue provides an online portal that gives you easy access to your claims and copies of explanation of benefits, ability to order a new ID card, search for network doctors and facilities, and compare the costs of procedures at various facilities. Florida Blue also offers a mobile app with convenient access to find network providers, a photo of your member ID card, deductible and out-of-pocket amounts, and more. Don't forget, you have access to call Florida Blue's Care Consultant team, and you can speak to a nurse 24 hours a day, 7 days a week. The Care Consultant team is a valuable resource in finding providers, planning for a hospital stay, and helping schedule appointments, managing ongoing medical conditions, and much more. See your benefits guide for more details. Sun Life's accident plan pays benefits directly to you in the event you or a covered family member are injured and receive treatment related to an accident. These benefits can help you pay for expenses associated with an accident, such as copays, deductible, and lost wages. Here are just a few things our accident plan covers. This coverage is guarantee issue. You do not have to answer medical questions.
Accidents are unexpected. You don't plan on them, and you usually can't prevent them. You never know when or where they'll occur. Playing sports, driving to the supermarket, even working around the house. And if they do happen, the out-of-pocket expenses that may come with a resulting injury can add up quickly. So how can you prepare? Having accident insurance can help reduce the financial impact of injury. If you experience a covered accident, you could receive cash benefits for your injuries, such as fractures and dislocations, as well as for the care of those injuries, such as ambulance rides and emergency room visits. The list of covered injuries and treatments will vary based on your plan. You can use the money you receive through accident insurance however you wish. For example, to pay for prescriptions, crutches, or other costs not covered by health insurance, so you have extra cash when you need it. Slips and falls can catch you off guard, but the expenses that come with them don't have to. Accident insurance can help you manage the out-of-pocket expenses associated with a covered accident, so you are prepared for life's emergencies.
Sun Life's critical illness plan pays benefits directly to you in the event that you are diagnosed with a covered illness. You can choose a benefit amount of $5,000, $10,000, or $15,000 on yourself, and $2,500, $5,000, or $7,500 for your dependents, and the plan pays a percentage of this amount to you based on the illness. The premium you pay is based on your age at the time of enrollment, and the rate will not change year after year. This coverage is guarantee issue only during this enrollment. You do not have to answer medical questions. There is a 12-month pre-existing condition limitation on this coverage.
We all want the same things out of life, to be happy and healthy. But an unexpected illness can take your plans off course. A major illness can be tough, and it can also mean an increase in out-of-pocket expenses and lost income if you are unable to work, even if it's just for a short time. Not what you want to worry about when you're sick. Critical illness and cancer insurance can help you take steps now to protect your finances should a critical illness or cancer happen to you. With critical illness and cancer insurance, if you're diagnosed with a covered condition, you receive a lump sum payment based on your diagnosis. It's that simple. Plus, you can use this payment any way you wish. For example, to help meet costs not covered by your health insurance, or to help with everyday expenses. Simply put, critical illness and cancer insurance allows you to focus more on your health and less on your financial health. Live your life to the fullest, knowing that with critical illness and cancer insurance, you're prepared for unknown costs you may face, so you don't have to rely on your savings alone.
Both the accident and critical illness plans offer wellness visit benefits. If you are enrolled and have a wellness screening during the plan year, you can receive a $50 benefit per covered person per plan year. Be sure to log in to Sun Life's online member portal, where you have access to find local network vision providers, download claim forms for accident and critical illness claims, and contact customer service for assistance. You can also register for a username and password to view your eligibility and claim status. When you are ready to make your benefit elections, log into the Ben Express enrollment system with your username and password using the format shown here. Your personal information and current plans are loaded in the system, but please review and update your contact information, dependent information, and life insurance beneficiaries. Ben Express will guide you through each benefit plan for you to make your elections. When you are finished, you may save or print a copy of your confirmation statement for your records. If you elect a coverage that requires an evidence of insurability form, you will be prompted to print the form at the end of the enrollment process. Please print the form and submit it to the carrier. Feel free to contact your representatives at Highland if you have any questions. We are proud to present this benefits package to our employees. Now it is time for you to take action. Be sure to review the benefits guide. Complete the enrollment online using Ben Express no later than the deadline given, even if you are waiving all coverages. Let us know if you have any questions, and thank you for your time.